Okay, so what I want to do now before I show you the stretch is I want to show you the anatomy so you can understand what's actually happening with your body and how we're trying to stretch this tensor fascia lata muscle. So if you look at this diagram right in here, you can see this blue area right in here, which is the IT band. You see that right up in here. So it has two parts. It has more of the fascia, which is down here. Then it has more of the muscle belly that's right up in here. Now, if I just kind of rotate this, you can see how this here is going to attach from your hip all the way down here. This goes right into your knee. So if you have a tight TFL, tensor fascia lata muscle, that's going to affect your hip. It's going to affect your knee. So we really want to try and work that out. Now, if we kind of roll around here to the opposite side, I'm going to hit this. You see, this is the top part right here. So you're looking at the top part right here, and that's the top part. You can see right here, tensor fascia lata. And then over here, we hit this part, the tensor fascia lata. So the side of the muscle here, the IT band or the tensor fascia lata, is on top of all the different muscles in your thigh here. So you can see how that dissection is. It's on top of that. That's where we really want to stretch it out and break down any scar tissue or trigger points that's in the tissue there. Okay, so here's a really nice picture of this in isolation here. You can see here, tensor fascia lata connects all the way there, and then it goes all the way up into your knee joint right in here. See how it connects down here in the lower part. So anyway, with that being said, let's get to the stretch. Take care. Okay, so what we're going to do is we're going to stretch your tensor fascia lata, the IT band. Remember from the video, it goes from here all the way your hip, all the way down to your knee. And again, you want to try different balls, the golf ball, baseball, tennis ball, or lacrosse ball. So let me show you how this is done, and this can be very, very painful. Okay, so remember, and when you look at the video, the bulk of the muscle is here in your hip, okay? And then the tendon kind of goes down here. So I start right in the hip, so I'm going to take a golf ball, and I'm going to stick it right in here, right where most of the belly is. I'll have like a pillow right here. And I feel it right there. You see, you want to just move around with it a little bit and just grind it out. Like, it's sore. So you want to grind it out there, and what you're doing is you're breaking down the scar tissue. So I'm right in the belly of the muscle. Now you might want to try some other things. Like here, you can do the baseball on the lower part of your leg right in here. And if you have problems here, it's not going to take a lot of pressure to actually, cause the pain. It should be a solid, dull, achy pain. You can press down here. And I generally, I've done a lot of exercise in my life, so sometimes my knees do bother me. So my tensor fascia lata is tender and it can be painful. You just kind of go back and forth, and yeah, that is sore. And again, you can put these in the freezer, freeze them. Let's just try the golf ball. So you just want to play around with it. So when you do this, is you want to do the whole entire leg. I like the baseball for the lower part, and you just want to do the leg, and that's sore. And you'll feel the muscles roll over just like a guitar string. And when you get on there, you just want to hold it, then roll off. Hold it, and then roll off. When you get on it, you can put some gentle pressure down in here. Now you got to work the upper part of the belly too, the one that's right by the hip. So I would probably say I didn't have a tennis ball, but the tennis ball probably would be the best thing up in here because the tennis ball is squishy, right? All these are really hard. You can just get on there. So you can see, can you get a picture of this? Right down here. You can see where that golf ball is right there. And the hip there, and just go in there and just roll it. And you can see it's sore. You can hold it there with your finger. So some of this is going to be some trial and error right there. Prop yourself up a little bit and just roll. Now if you can't prop yourself up, okay, so let me show you the position of the golf ball right here, because I just looked at the video I took and it looked like you can't really see the golf ball. So you can see right here, I'm just going to position it right in this muscle belly right here. So your hip, you're going to feel like your hip bone, just to give you some orientation. There's my hip bone. You should be able to kind of feel your hip bone right in here, and you want to push it right, put it right up in here. So right up in here, so you can see where I'm at right there. And then just grind it right there. You see the golf ball right in there. And then back and forth. And you can get in there and you can really grind it out. And if you have a problem, it's not going to take a lot of pressure to start to break down these scar tissues and the muscles and the trigger points. Okay. So
With that being said, these are all really simple home therapy things that you can do at home. And just play around with the different balls, put them in the freezer, and let me know how it goes. This is Dr. Hugh. And remember, where there's help, there's hope. Take care.